Welcome to Just-in-Time ICD-10 training for providers. In this course, you will learn about the ICD-10 related changes that you will come across while documenting patient encounters, as well as the tools designed to help you transition from ICD-9 to ICD-10. Before you can work with ICD-10, your NextGen ambulatory EHR must meet certain requirements. NextGen Ambulatory EHR 5.8 and KBM 8.3 are the minimum versions required to support ICD-10 functionality. In addition, your practice must apply the version-specific ICD-10 hotfixes and complete all ICD-10 related setup. To familiarize you with the ICD-10 related changes and enhancements, I will demonstrate two general provider workflows in the NextGen Ambulatory EHR, one during the ICD-9 effective period and one after ICD-10 has taken effect. The workflows included in this demonstration were documented in a family practice office visit encounter and have been captured in a 5.8 UD2 KBM 8310 database, so you may note some differences in the layout depending on your specialty and the application version your practice is currently using. However, the basic appearance and function of the ICD-10 related tools is consistent for all released EHR 5.8 KBM 83 versions and specialties. The material included in this course assumes a basic level of familiarity with working in NextGen Ambulatory EHR 5.8 and KBM 8.3. If you are new to EHR 5.8 and KBM 8.3 or would like additional ICD-10 information, please refer to the NextGen Knowledge Exchange documentation, training materials, webinar information, and links to additional e-learning courses. To easily locate all ICD-10 resources from the homepage, click the ICD-10 link. From this page, you can quickly access frequently asked questions, links and resources, the ICD-9 ICD-10 comparison utility, and register for upcoming webinars by selecting the links provided. Now, let's look at the ICD-10 related changes that can be seen when documenting an encounter during the ICD-9 effective period. NextGen Ambulatory EHR 5.8 and KBM 8.3 have been designed to accommodate the transition to ICD-10. In EHR 5.8 and higher, the Problems module has been divided into the Problems list, which stores a history of clinical problems as SNOMED codes, and the Billing ICD list, which stores encounter-based billing ICD codes. Problems and billing diagnoses have been moved into grids, both in the Problems module and on most templates, to accommodate the longer codes and descriptions of ICD-10. In addition, hard-coded ICD-9 codes were removed from templates that include orders that pass charges into the superbill. A new diagnosis search tool was added, and the common assessment template was revised. Dual coding for encounters and dual coding in the orders module were added with the ICD-10 hotfix, providing a tool to help familiarize you with ICD-10 equivalents, build an ICD-10 diagnosis history and patient records, and smooth the workflow for future and recurring orders that cross the 10/1/2015 effective date. I'll log into EHR to demonstrate these features. I've logged in as Dr. Matthew Abbott and will follow the provider workflow for a family practice office visit for Daniel Solera that takes place during the ICD-9 effective period. The demonstrations included in this course will only show the steps of the workflow that include elements that have ICD-10 related changes and are not meant to represent a complete workflow. In addition, specific procedures, problems, and billing codes have been selected in order to provide a brief but complete overview of the ICD-10 related tools and features and do not necessarily represent a true clinical scenario. Let's start with the Reason for Visit panel. There is one notable change to the HPI templates that is related to ICD-10. To save time, I'll go ahead and complete the headache HPI. I've completed the assessment portions of the headache HPI. The only ICD-10 related change is that all hard-coded ICD-9 codes have been removed from here and all other templates that have charges associated with orders. I'll select the CBC, and the default ICD-9 code displays in the fields. The code can be changed by clicking in the field to launch the Diagnosis Search dialog box. The diagnosis and code fields have been expanded to accommodate the longer codes and descriptions of ICD-10. I'll place the order and then go ahead and complete the Reason for Visit documentation. There are no further ICD-10 related changes on the Reason for Visit panel. and none on the review of systems or vital signs. I'll expand the physical exam panel. As on the HPI templates, hard-coded ICD-9 codes have been removed from physical exam templates that submit charges with orders. Let's look at the one-page exam. I'll add the default normal well man exam, document my exam, and add the EKG. As on the headache HPI, hard-coded ICD-9 codes have been replaced with longer fields to display the assessment and code. I'll document the results, and then click in the assessment field to associate an ICD code. The diagnosis search screen displays a selection of cardiac-related ICD-9 billing codes. You can select from these codes or search from any of the options on the left menu. I'll double-click to select the desired code. And diagnosis status. The expanded fields display the description and code. I'll submit the code to the superbill, then save and close. Any additional sections of the physical exam that include orders that submit charges have been similarly updated in preparation for ICD-10. I've completed the physical exam and will move to the Add or Update Assessment template. The Add or Update Assessment template has also been updated with grids to display the patient's billing diagnosis history, clinical problems, and today's assessments, as well as the provider's favorites. You can add an assessment from any of these fields or search for a diagnosis using the Common Assessment or Diagnosis Code lookup. To save time, I will go ahead and add the billing codes to today's assessments. The assessments that were added display in the Today's Assessments grid. All of the other tabs have been updated to include this data grid. For example, I will navigate to the My Plan tab. Today's assessments display in the data grid. The options to add an assessment from the Common Assessment and the Diagnosis Search are also included. Since no other ICD-10 related changes are included here, I'll close the template and move to the Orders module to demonstrate dual coding for orders. I navigated to the Orders Summary tab of the Orders module. Dual coding can be used in the Orders module to associate ICD-10 codes with new, future, or recurring orders that will occur on or after 10/1/2015. Dual coding should not be used in the Orders module for any orders that have instances that will occur before 10/1. I will go ahead and add a few orders that will be scheduled as future or recurring. Now, I'll schedule these orders as recurring orders. I'll set the urinalysis and urine culture to begin today and the hemoglobin A1C to begin in 3 months. I've completed the scheduling and will accept and close. Now that the orders have been scheduled, I'll demonstrate dual coding. Although dual coding for orders utilizes the Encounter Dual Coding dialog box that displays, it is important to note that the functionality in the Orders module is different from dual coding for encounters. Dual coding in the Orders module immediately updates the order with an ICD-10 billing code, while dual coding for encounters stores the ICD-10 codes in a table and does not change the billing code for the encounter. Dual coding should only be used in the Orders module if the order does not have any instances that occur before 10/1. The V18.0 code associated with the hemoglobin A1C is a direct one-to-one mapping between ICD-9 and ICD-10 and is automatically mapped. Code 401.1 also has a direct one-to-one mapping but will not impact the Orders module as no orders have been associated with the code. All of the codes that display in red require manual mapping. I will not map them here as I do not want to change the codes for any orders associated with them. Only the hemoglobin A1C that is scheduled for November is associated with a mapped code, so I'll complete the dual coding by clicking OK. Only the code associated with the hemoglobin A1C order has been updated. You do not have to dual code an order when it is placed. Dual coding can be used to update an order that has been previously saved either in the Orders module or from the Order Management Control template by the staff that manages this function. I'll save these orders and close the Orders module. Now, let's look at dual coding for encounters. Although you can access dual coding for encounters at any time, the recommended workflow for dual coding an encounter is to wait until you have completed all documentation and are ready to finalize the encounter. The ICD-9 codes that are associated with today's assessment display. You can launch dual coding for encounters at any time in an open encounter by clicking Tools on the main toolbar and selecting Dual Coding for Encounters from the menu that displays, or by clicking the Dual Coding button that you can add to the top toolbar. All of the codes that have been added to the encounter display on the Encounter Dual Coding Today's Assessments grid. Any mappings that were completed during dual coding in the Orders module also display. Dual coding the remaining ICD-9 codes will not impact the orders that require ICD-9 codes. However, dual coding the encounter will smooth the process for instances of orders that were placed with ICD-9 codes but occur after ICD-10 is effective. If a code does not have a direct one-to-one mapping, it must be manually mapped. To map code 806.04, I will click the right arrow on the row. Due to the greater detail and specificity of the ICD-10 codes, some ICD-9 codes can be mapped to more than one code in several scenarios. For example, code 806.04, fracture closed C1-C4 with spinal cord injury NEC, must be mapped to a specific code for the level as well as a second code for displaced or non-displaced. You may need to scroll to view all options. In this case, I'll select Scenario 3. The code for other incomplete lesion at C3 level of cervical spinal cord initial encounter is selected by default. To complete the mapping, I'll select the S12.201A non-displaced fracture option and click OK to save the mapping. A second row is created for 806.04 and the two ICD-10 codes display. Next, I'll map 806.62. In this case, the ICD-9 code maps directly to code S34.3XXA for injury of cauda equina initial encounter, but also requires a second ICD-10 code to identify whether there is an unspecified fracture of the sacrum or fracture of the coccyx. I'll select the fracture of coccyx option and then click OK to save this mapping. 806.62 displays as mapped to two ICD-10 codes. The last three ICD-9 codes are all examples of ICD-9 codes that can be mapped to one of several single ICD-10 codes. For example, I'll dual code 784.0 headache. A list of single ICD-10 codes that can map to 784.0 displays. You should review the codes and then select the appropriate one for the particular patient situation. If you do not want to use any of the mappings provided, you can search using any of the menu options to the left. I'll double-click the row to select ICD-10 code R51. And then I'll go ahead and map the last two codes. Once all codes have been mapped and display in green text, click OK to save and close dual coding for encounters. The ICD-9 codes displayed on today's assessment have not changed. The ICD-10 codes will be saved in the dual coding table and will be added to the patient's billing history when the dual coding script is run on the eve of 10/1, making it easier to select the appropriate code after ICD-10 is effective. Your practice has the option to add a macro to documents that will display both the ICD-9 and ICD-10 codes that were added during dual coding for encounters. No changes have been made to the Evaluation and Management coding panel, so I'll go ahead to calculate and submit the encounter code. The charges have been submitted. For demonstration purposes, let's look at the superbill to confirm the correct codes have been associated with the charges. Only ICD-9 codes have been submitted with the encounter. In this demonstration, you saw the ICD-10 related changes and tools that are included in your NextGen ambulatory EHR before the 10/1/15 ICD-10 effective date. The next lesson will demonstrate ICD-10 related functionality in the workflow after ICD-10 is effective. In this demonstration, you will learn about the enhancements and tools that will be available on October 1st, 2015 and after for working with ICD-10. The assumption for this demonstration is that all required and recommended setup has been completed for your NextGen ambulatory EHR as specified in the ICD-10 implementation checklist. For demonstration purposes, I have completed all setup using an ICD-10 effective date of 7/1/15 in my test database. Some of the changes that you will encounter include the update of default codes from ICD-9 to ICD-10, the inability to select ICD-9 codes or workflows that require you to select an ICD-10 equivalent, the updated Common Assessment template, the inclusion of dual-coded ICD-10 codes in the billing ICD history, updated immunization orders and inventory, and the ICD Intercept tool. I'll log into the EHR and take you through an encounter after ICD-10 is effective. I've created an encounter for Daniel Solera, the same patient that was selected for the ICD-9 workflow demonstration and navigated to the SOAP template. Before I start the workflow, I'll open the Billing ICD list in the Problems module and expand the encounter that was used for the demonstration of ICD-10 preparations in Lesson 1. As part of the ICD-10 setup process, I ran the dual coding script to add the ICD-10 codes that were mapped using dual coding for encounters to the billing history. The ICD-10 equivalents of the ICD-9 codes are now selectable from the patient's billing history during the current encounter. I'll take you to the workflow to demonstrate ICD-10 related functionality after the ICD-10 codes are effective. To save time, I've already completed some of the basic documentation for this encounter. Let's start with the Reason for Visit panel. I've documented most information on the headache and injury reasons for visit. I'll open the headache HPI. To add a CBC to the office labs, as I did in the ICD-9 encounter. The default diagnosis code has been updated to the ICD-10 equivalent based on the effective and expiration dates of the code sets. I'll go ahead and place the order and then close the template. Next, I'll move to the Vital Signs panel. While no changes have been made to vital sign documentation, for procedures or other orders that are accessed from this panel, the billing codes have been updated to ICD-10. For example, I'll open the Health Promotion Plan template. As on other templates that require a billing code, this template has a diagnosis field and a code field that can accommodate the longer ICD-10 descriptions and codes. If you click in the diagnosis field to select a code, the BMI category displays in the results field for you to select the appropriate code. You can also search for a code using any of the left menu options. I'll select Patient's Diagnoses. The diagnoses from the Billing ICD list display, but only the ICD-10 codes are selectable. I will cancel and close the Health Promotion Plan without adding a plan at this time. Next, let's look at the Physical Exam template. The exam has been documented with the exception of the EKG. Again, in the interest of time, I went ahead and documented the EKG results. Now I'll select the assessment. The default display is the Circulatory System category with only ICD-10 codes available for selection. I can select from this menu or from any of the other options available on the left menu. I'll select my hypertension favorites, which have been updated to include only ICD-10 codes. I'll double-click to select code I-10 and select the diagnosis status. Now I can submit the EKG charges with an ICD-10 code. All other standard templates with orders have been similarly updated to include ICD-10 codes. However, in some circumstances, custom templates may have been hard-coded with ICD-9 codes. If the custom template has not been updated during the ICD-10 setup, you may still be able to add an ICD-9 code when the charge is submitted from these templates. These codes will be captured by the ICD Intercept tool when you attempt to finalize the encounter, which I will demonstrate later in this lesson. Now, let's move to the Add or Update Assessment template. The codes that were added to today's assessments from the HPI and physical exam templates display in the grid. As before the ICD-10 effective date, you can still select from the billing diagnosis history, clinical problems, or my favorites to add to today's assessments, as well as using the common assessment or the diagnosis search screen. First, I'll search for and select History of Depression from Daniel's Clinical Problems. Since this problem has been previously associated with an ICD-9 code, an alert displays noting that the selected diagnosis code is invalid and I need to select the valid code. I'll acknowledge the alert by clicking OK. And the diagnosis selector screen automatically displays the legacy ICD mapping. If the code has a one-to-many mapping, you may have to select from more than one code in the search results. Since only one result displays and it's highlighted by default, I'll click Select and add the diagnosis status. Once I add the assessment, the system will memorize the new ICD mapping in Daniel's clinical problem list. The billing diagnosis history displays both the ICD-9 and ICD-10 codes. I'll select the ICD-9 code for abdominal pain from Daniel's list. I'm prompted to add the status, and then the legacy ICD mappings display. Since ICD-9 code 789.09 can be mapped to multiple ICD-10 codes, I have the option to select from the results displayed. I can also use any of the left menu options to search for an alternate mapping for this patient. I'll select the R10.30 lower abdominal pain unspecified ICD-10 code for Daniel. I'll also add the diagnosis to Daniel's clinical problems, which will save the SNOMED to ICD-10 mapping for his future encounters. If the ICD-10 code had not already been added to my favorites, I could select the My Favorites checkbox to update the list. I'll click Add Update to add this assessment to today's assessments. I'm prompted to select the SNOMED mapping for the clinical problems list. I'll select lower abdominal pain, and the diagnosis is added to Daniel's clinical problems. I'll open the common assessment, where all codes have been updated to ICD-10. I'll close without adding any codes from here. Let's look at the updates to the diagnosis code lookup. Only ICD-10 codes will be returned for a search using all diagnoses. As you saw earlier in the encounter, when patient diagnosis is chosen, only the ICD-10 codes are selectable. If all setup has been completed, favorites and categories will also contain only ICD-10 codes. If you know the ICD-9 code for a diagnosis, you can use Legacy ICD Mapping to identify the ICD-10 equivalent. I'll scroll to select this option and search for the 250.00 ICD-9 code. All mapped ICD-10 equivalents display in the search results. I'll cancel to close without adding this code. The other tabs include the grid for today's assessments, with the options to add a code using the Common Assessment or Diagnosis Search tool. There are no other ICD-10 related changes on this template, so I'll save and close. While the appearance of the templates may vary somewhat based on your KBM version and specialty, the basic functionality remains the same. For example, let's look at the Cardiology Assessment Plan panel. I've navigated to the Assessment Plan panel in the Cardiology Specialty Template set. If I click History to search from Daniel's billing history, his full ICD-9 and ICD-10 billing history displays. I can select an ICD-10 code from the list. However, I'll select an ICD-9 code from the diagnosis history. The ICD Legacy Mapping results display the ICD-10 equivalents to select from, and the ICD-9 code cannot be added. I'll select code I49.8, and then cancel to close without selecting any additional codes. When I select an option from the left menu, the related category displays by default with the ICD-10 codes in the results pane. I'll select the R94.31 Abnormal Electrocardiogram ICD-10 code. Although the cardiology workflow differs from the general workflow, the enhancements designed to update ICD-9 codes to ICD-10 have the same functionality. Now, I'll take you back to the general workflow demonstration. I've navigated back to the SOAP template in Daniel's Family Practice Office Visit. In addition to the changes that have been demonstrated on the templates, ICD-10 codes have been incorporated in the EHR modules. In the Medications module, the ICD-10 codes from the patient's billing history will display for you to associate a prescription with the diagnosis. The Procedures module also includes ICD-10 related changes. I'll open the Procedures module and select Laceration. I'll enter some basic information to display the billing code fields. To select the code, I'll click in the indication field. The diagnosis search screen displays with the Laceration Simple category selected by default. As on other templates, you can use all search options to select an alternate code. Some procedures will have one default code attached. In those scenarios, the ICD-10 code will automatically display in the field. I'll cancel out of the Procedures module without adding this procedure. Next, we'll look at the Orders module. To save time, I'll go ahead and navigate to the Orders Summary tab of the Orders module. If you are placing a new order, the ICD-9 codes will not be selectable. However, there may be pending orders that have ICD-9 codes attached. In many cases, if an order was placed with ICD-9 codes before October 1st and was not dual-coded, the code will update automatically based on encounter dual coding or system mappings. The codes may also be updated by office staff on the Order Management Control template. You do have the option to use dual coding in the Orders module to update the codes associated with an order. In this example, the urinalysis and urine culture are recurring orders that had instances before 10-1. I'll double-click the row to select it. The Update Lab Order template displays. I'll click Dual Coding, and the Encounter Dual Coding dialog box displays. The ICD-9 to ICD-10 mappings that were added when I dual-coded the encounter in which the order was placed display by default. I'll click OK. The alert displays to notify you that only the test diagnosis can be updated on recurring orders. I'll click Yes to continue. The billing codes have been updated to ICD-10. Now, I'll close the Orders module and navigate to the Finalize template. When the ICD-9 codes were effective, you would complete dual coding for encounters at this point. Now that ICD-10 is effective, dual coding for encounters should no longer be used, and the dual coding button can be removed from the top toolbar. If all ICD-10 setup has been completed, you should not be able to add an ICD-9 code in an ICD-10 encounter. However, if all updates have not been completed, there may be places in the EHR that will allow you to add an ICD-9 code. For this demonstration, I changed the effective date in order to be able to add the 493.90 asthma unspecified code, and then expired the code. I'll move to the Evaluation and Management Coding panel. To finalize the encounter, I'll select the complexity and then calculate and submit the code. If the 493.90 ICD-9 code had a direct one-to-one ICD-10 mapping, the code would have updated automatically and no window would display. Since there is not a direct one-to-one mapping, the ICD Intercept tool is triggered and the Procedure Charge Mapping dialog box displays. Your practice should have a process in place to document when the ICD Intercept tool is triggered so the appropriate updates can be made in your system. The ICD-9 code that requires mapping displays in the ICD-9 field in red text, while all ICD-10 codes display in green. To map the code, I'll click the ellipsis on the DX5 row. This code is an example of an ICD-9 code that can map to a selection of individual ICD-10 codes. As with dual coding, you may also have to select from scenarios that include more than one ICD-10 code. I'll select the J45.909 unspecified asthma uncomplicated ICD-10 code. All codes display in green text with an ICD-10 code. I'll click OK to save the mappings and close the dialog box. The system will automatically submit the charges once the ICD-9 code is mapped, with no further action required. I'll accept and electronically sign the document. The charges have been submitted. As in the first lesson, for demonstration purposes, let's look at the superbill to confirm the correct codes have been associated with the charges. All codes submitted for this encounter are ICD-10 codes. No action is required in the EHR if the encounter is associated with a payer that is a non-HIPAA covered entity and ICD-9 codes are required. All mapping to ICD-9 codes for these pairs is accomplished by setup and file maintenance and the ability to map ICD-10 to ICD-9 on the fly in the practice management application. In this demonstration, you learned how to add ICD-10 codes in the workflow after the October 1, 2015 ICD-10 effective date. For further information and educational opportunities to prepare for ICD-10, visit the ICD-10 portal on the NextGen Knowledge Exchange.